A new study out of UCSF shows that fatty liver disease is impacting Latinx children more than any other group. So joining us now to discuss this is the author of the study, Dr. Sarah Maxwell. Thank you for joining us.
Hi, thank you so much for having me.
What's behind this surge in showing how this group is impacted more than any other?
Yeah, so we actually found that exposure to household food insecurity in families of Mexican and Central American descent living in San Francisco was associated with nearly a 4 times increased odds of MASLD, which is the new name for fatty liver disease, in middle childhood. So that this relationship has been found in adults, but this is one of the first studies to find this in children.
So it was it was able to show how food insecurity leads to fatty liver disease. How do those two things relate to each other?
Yeah, so we found an association with children who were exposed to food insecurity at 4 years of age and fatty liver disease. We don't understand the mechanism at this time, and that's actually one area of further research that we're currently working on. But children who are in households with food insecurity may have less access to a sufficient quality and quantity of healthy and nutritious food. So for instance, children might be eating more sugary drinks or more processed food or fast food. Potentially, food insecurity may change how your body actually stores fat and manages glucose, which is one of the main roles of the liver. And it might also alter how the microbiome works with the liver and the gut. So we think there's a lot of potential mechanisms that, again, are areas of future research that we're excited to work on in the future.
And what is fatty liver disease? What are the consequences of it, maybe as a child and even as that child then grows up into adulthood?
That's a really good question. So fatty liver, actually, it was just renamed metabolic dysfunction associated steatotic liver disease. And this means it is fat in the liver. And if that fat persists, it can actually turn into inflammation and then scar tissue. And if it turns into scar tissue, it can turn cirrhotic and actually lead to end-stage liver disease. So basically, fatty liver, or MASLD, is going to be soon, in the next, they predict, 5 or 10 years, the leading indication for liver transplants in adults. And so it's really important to try to identify risk factors now so that hopefully we can intervene in children before this progresses to a stage where, as young adults, they might be needing liver transplants.
And since this is one of the first studies done on children trying to show these connections, I found it interesting that the study was saying that it also then highlighted the importance of public health food programs like school lunch, that could be a way that this group that's experiencing food insecurity could get some food that's nutritious and then try to prevent this disease from happening later on in life.
Exactly. So we think it's really important for the medical system, and especially for pediatricians, to team up with organizations that help provide access to healthy and nutritious food for families at risk. And so actually some of the future work we're doing is actually piloting fruit and vegetable voucher programs for families with food insecurity and fatty liver, and trying to, again, try to promote both pediatricians and schools to try to improve access to an adequate quantity and quality of healthy, nutritious food. Because sadly, just too many children, especially minority children, do not have enough access to healthy and nutritious food. And then it seems like children, especially those who might be overweight or of Mexican and Central American origins, that then this food insecurity could increase their risk for fatty liver.
And the researchers are recommending that screening should just be happening sooner?
Yeah, we're starting to see kids with fatty liver and even some fibrosis, so scar tissue in their liver, at earlier and earlier ages. So they are starting to change the guidelines now, but we think that just based on what we're seeing is that even, especially for those at higher risk, and there have been some genetic mutations associated with in certain ethnic groups. So for those of Mexican or Central American origins, there are a few known mutations that increase risk for MASLD, but it's beyond that. So the risk is not just if you have this gene, you'll get this disease, but what in addition to the gene can increase risk or And then if we find what increases risk, what can we then do to try to mitigate this additional risk? And so this is one potential avenue. So for people who we know are at higher risk for development of MASLD, if then potentially we also know that they have food insecurity, can we try to reduce food insecurity? And then potentially could that reduce that risk for MASLD in the future?
Dr. Sarah Maxwell, thank you so much for joining us this afternoon so we could talk more about this study. Appreciate your time.